Good afternoon, everyone. My name is Kristen Wan, and I'm with the Maternal and Child Health team here at the Association of State and Territorial Health Officials. I would like to welcome you to today's interactive webinar, Worksite Wellness and State Health Agencies, Implementation of Healthy Maternity Policies. ASTHO, with support from HRSA's Maternal and Child Health Bureau, is excited to host today's webinar, which will highlight different strategies that state health agencies are using to better integrate healthy maternity programs and policies into the workplace. The objectives for today's webinar are to provide an overview of ASTHO's environmental scan of worksite wellness programs and policies in state health agencies, provide examples of how state health agencies can support and implement effective healthy maternity policies within their department, and to provide examples of how state health agencies can support local businesses to develop and implement their own healthy maternity policies. We have an esteemed panel of experts that will be speaking with you today. Following my introductions, all of the speakers will present their slides. If you have a question, you are welcome to post it in the chat box on your screen at any time during the webinar. These questions will be used during the Q&A after today's presentations. At the conclusion of the webinar, you will be directed to an evaluation survey. Please take a few minutes to inform us about the work you are doing to support and implement healthy maternity programs and policies in your state, and to provide us feedback on today's webinar. We look forward to hearing about your efforts. Our first speaker is Tara Johnson. Ms. Johnson is a Senior Analyst for Evidence-Based Public Health at ASTHO and supports projects in the areas of evidence-based public health, workplace wellness, maternal and child health, and chronic disease. Ms. Johnson received her MPH in Health Policy from George Washington University and is also a Certified Worksite Wellness Specialist. I will now turn it over to Tara.
Thank you, Kristen. Today I'm going to take a few minutes to review the ASTHO's environmental scan that we did last year, where we did an environmental scan on the worksite wellness policies and programs in state health agencies. And I will also take a brief moment to talk about the Health Aid Accreditation program that ASTHO has gone through. So the environmental scan that we conducted was with health departments, our members across the country, and we gathered follow-up data from a 2010 survey that we had conducted. This survey was very brief in 2010, and we had our senior deputies and state health officials respond to us about the worksite wellness that was going on in the state health agencies themselves. We wanted to also gain a better understanding of how ASTHO could assist states in implementing their worksite wellness policies and procedures. We did get some help from the GW graduate students that worked with us. We conducted this survey by calls and interviews, and we also had an online survey. We did get responses from all 50 states, and we are going to discuss, well, I'm going to discuss some of the results that we found. I'll focus on the responses related to maternity policies. So the first question we asked was, does your department have healthy maternity policies? And gave examples like lactation rooms or paid maternity leave. 92% of states responded that they have healthy maternity policies in some fashion. 72% of state health agencies responded that they have a policy to promote and encourage breastfeeding in the workplace. Some respondents said that they had support to breastfeed, but it wasn't necessarily a formal policy, or there wasn't a formal place for them to breastfeed or to have lactation support. 96% of state health agencies responded that they have some space available for employees to pump during the workday, such as a lactation room. This was interesting because it's a higher percentage than those who responded that they have healthy maternity policies in general. When we dug down into the qualitative responses, we found that some agencies would use offices or areas designated as lactation rooms for pumping, but there was not an official policy to have the lactation room. 43% of state health agencies have paid maternity leave. And again, the responses varied in terms of the percentage of pay and the time off that they received for maternity leave. This slide here is an overview of the results. I just focused on the maternity questions, but we did ask the state health agencies about smoking policies, nutrition policies, their employee assistance programs, EAPs, and other activities that they did with their worksite wellness. Overall, we found that activities in state health departments are very common. They're highly variable, and they're expanding with increase of prevalence from 2010 to 2012. We also found that many departments are reporting planning and implementation of future worksite wellness programs. We did not find regional trends in worksite wellness, and we did also find that smoke-free and healthy maternity policies are nearly universal, while nutrition policies were rare. There was a need, we heard a need for best practices and recommendations for worksite wellness in state health agencies, and that is one of the reasons why we're having this webinar, and another reason why we have some resources on our website. Here is a snapshot, a screenshot of our worksite wellness webpage. Here you will be able to find some best practices in state public health. We have a few case studies on there, and we have quite a few that are in communications right now. We are hoping that within the next month or so there will be a lot more on there, a couple of issue briefs as well as state-specific case studies. And ASTHO as an organization, we really encourage state health agencies to consider the emotional and physical well-being of their employees and to consider how worksite wellness programs can support that effort. You know, as organizations that are promoting the health of their citizens, it's really imperative that we're taking care of our own employees and serving as a model for other agencies and businesses in our communities and walking the walk, so to speak. ASTHO as an organization walks the walk by having a robust, comprehensive worksite wellness program that embraces continuous quality improvement. ASTHO as an organization went through the Healthlead Accreditation program and was awarded a bronze level status in 2012. If you go to our worksite wellness website listed here, there is a link to our internal worksite wellness website. There's more information on Healthlead there, but also about our internal worksite wellness program, where we list our policies, such as our healthy foods policy. We've been asked quite a bit about what Healthlead is, so we wanted to make sure there were a few slides here for you all. Healthlead is an accreditation program that includes objective evidence-based assessment. The comprehensive two-step accreditation process includes a site visit by professional experts on worksite wellness, and there is an opportunity for quality improvement. So going through this assessment, you don't just go through it once and see if you're accredited or not. There are really concrete steps that you can take to move the needle, so to speak, and move towards getting accredited through the program. As you can see here, there are Healthlead practice areas. One of the unique aspects of Healthlead is the focus on the organizational alignment, and you can see on this chart the areas where alignment is identified. It's truly a comprehensive assessment tool that allows for feedback and quality improvement. Here's a slide on the resources that we have. Again, please definitely go to our website listed here. There are quite a few resources on it, and again, we'll have a lot more in the next month or so. We also have the Healthlead website listed here. It's www.ushealthiest.org, and we encourage you to visit those, and please feel free to contact me if you have any questions regarding worksite wellness initiatives at ASTHO, or if you are interested in learning more about initiatives in other states. And also, if you're interested in learning more about Healthlead, I'd be happy to get you in touch with the experts there. And with that, I'll hand it back over to you, Kristen.
Great. Thank you, Tara. Okay, and as you can see on your screen, we have a polling question up. Does your agency or organization offer paid maternity or paternity leave? Please go ahead and submit your answers now while I introduce our next speakers. Our next speakers are Dr. Terry Dwelly and Kim Hinnenkamp from the North Dakota Department of Health. Dr. Dwelly was appointed as the North Dakota State Health Officer in October 2001. Under Dr. Dwelly's direction, the Department of Health works to provide creative public health solutions to the health and environmental issues facing the state. He leads an agency of more than 300 professionals working to protect and enhance the health of every North Dakotan. Ms. Hinnenkamp is the WIC Nutrition Services and Breastfeeding Coordinator at the North Dakota Department of Health, Division of Nutrition and Physical Activity. She works with a supplemental nutrition program for women, infants, and children and oversees both the nutrition services and breastfeeding components of the program. Okay, and as you can see, our poll is now closed, and it looks like most participants today do not offer paid maternity or paternity leave. And with that, I will now turn it over to Dr. Dwelly and Kim Himmenkamp from North Dakota.
Thanks, Kristen, and it is a real pleasure to be with you all. I'm just going to talk just a few minutes and then turn it over to Kim, who will give more details on our program. But comprehensive worksite wellness is a part of the North Dakota Department of Health strategic plan and has been part of that plan for several years. And maternity and baby-friendly programs are part of comprehensive worksite wellness as it relates to the department. This next slide just demonstrates the fact that individuals are generally members of multiple communities. And as part of our strategic plan, we do community engagement in various forms for all of those communities across our state and try to focus on these. And these communities impact our beliefs, values, the institutions, the way we do things, and eventually our behaviors. That's how societies have functioned throughout history. And as you can see on this slide, there are essentially 5 groups of communities that we can divide them into. There are rural towns, usually about 1,000 to 1,500 people that act like a community. There are schools, which are very complex communities that are oftentimes stratified based on staff, students based on age, homeroom, sometimes other organizations. We have faith-based communities. We have work sites that oftentimes act as communities. And then we have other organizations like Kiwanis, Optimist Club, Rotary, Knights of Columbus, internet or virtual communities, political groups, etc. This next slide just talks about some of the 3 major tools that we have to change risky behaviors in communities, including policy, influencing individuals one-on-one, this is the clinical, and then population-based interventions. I think we're all familiar with policy. Policy is developed by local, state, federal governments, businesses, and organizations, and is an effective tool to encourage healthy behaviors, but must be implemented and enforced to be effective. Clinicians are trained in one-on-one counseling, another powerful strategy to change risky behaviors. And then we have population-based interventions. I mean, this is the area of public health specifically that provides another potent behavioral impact and can be divided into 2 tool subsets: social marketing and community engagement. And community engagement is facilitating groups of people to own their problems and solutions. Now, policy is particularly where the mother and baby-friendly programs are found in a comprehensive worksite wellness program that deals with that worksite community. And good policy, like mother and baby-friendly programs, also relates to another very important thing in departments that we call worksite culture. We may not be able to increase the salaries as wished due to fiscal constraints, but we can create a better worksite culture like mother and baby-friendly programs. So at this time, I'd like to introduce Kim Himmenkamp, who will discuss some of the details of our current Department of Health program for mothers and babies. Kim.
Thank you, Dr. Dwelly. As Dr. Dwelly mentioned, I'm going to talk about our policy, both our infant to work policy as well as our other breastfeeding support policies here at the Department of Health. So why support breastfeeding in the workplace? I mean, we all know about the health benefits of breastfeeding, and so really, especially in our state of North Dakota, many of our mothers have to work, so it's really important, or we feel important, that supporting breastfeeding in the workplace will really help those moms be able to meet their breastfeeding goals as well as have healthier moms and babies. On this slide, I list some of the benefits to employers. You can kind of just read those on your own. One of the things that I want to notice specifically within my division that I've noticed with the myself, who has brought both my sons to work, but as well as some of my coworkers, is that they were able to come back to work earlier or have a little bit different schedule because of the fact they were able to bring their babies to work. It really was a very good benefit for them, as well as when the employer was able to get that employee back quicker, so their time away wasn't as long. But as you can see, some of the other things about reduced sick time, higher job productivity, reduced staff turnover, some of those things are listed on the slide, and there are many more as well. We started our Infants at Work program here at the North Dakota Department of Health back in 1996, so it'll almost be 20 years old here in a couple of years. They started first as a pilot project and then expanded it obviously to the whole entire Department of Health. Because of the success that we received here, we have given our policy and shared it with other state government departments as well as other just agencies across the state. And basically our policy states, and I'll get into a little more specifics, but that you can bring your baby to work for the first 6 months of life. And in that picture there, as I mentioned, I was able to bring both of my sons to work with me. That's my oldest son. They're actually getting close to when he would graduate, or close to his 6 months time period. But I just know that for me personally, it was just, especially with my first son, it was so hard to come back to work in the first place, that if I wouldn't have had that option, it just made it so much easier for me to get back into work and be able to know that he is there with me. It was just such a great, great benefit, as well as being able to help me reach those breastfeeding goals that I had set myself for. That helped tremendously with that as well. So some of the guidelines are listed there as part of, we have a formalized infant at work policy that's part of our personnel manual. Some of the things listed there are basically that the parent obviously has to bring in the furniture for the baby, as well as we have some requirements about disposal of diapers, because that can be an issue for other staff around the person that is has the baby. We also say that the infant should stay in the parent's workspace, but it can also be obviously taken out, and it all kind of depends on how your division works in terms of with the baby in there and stuff like that. But we also want to be sure that we are considerate of staff that are, that may not be as baby friendly as other staff. We do say that the situation should be evaluated weekly with the division director in case there are issues with other staff or just with work issues with the baby being there, and then as well as the infant not being able to travel in state vehicles. So I know I didn't do any traveling really when I had my sons with me, but I know some of my coworkers then just use their own vehicle and we're still able to bring their babies to work with them on their travel. We also had developed a lot of forms and things as well. So we have a form that basically when the mom wants to bring the baby, or the parent does, that then they need to fill that form out, as well as a summary after the baby has left, a liability form, as well as other checklists. We have a safety checklist within our division for babies, as well as tips from moms and parents that have brought their babies to work with them. So we've developed several other forms including that as well. On this slide shows our first baby to work. Like I mentioned, that was back in 1996. And right now, that date was 2011, that she was 15 years old. So we've got a lot of babies come through our program, but I thought it was neat to show that picture of the first one that was here. This slide shows just this past summer the 4 babies that were in the section that I work in with, which is the community health section. So that's a picture of their moms and their babies that were just here. We don't have a count of the total number of babies that have come through the health department, but I know that there's been many. I know when I had my second son, there was probably 5 or 6 of us within like a 6-month period that were bringing their babies, and I know there was more that followed him as well. So I think within that year we had babies constantly up here. The other part of our breastfeeding policy, besides bringing babies to work, as well as we have a policy about infants at childcare. So basically, once the baby's done being at work with us, then the moms are still able to pump, or we have a flexible working schedule so they can go to their baby at daycare and nurse them as well. And this, even though now there's a federal breastfeeding legislation that requires this for many of our many employees across the country, this policy had been in effect since the infant at work policy was. So back in 1996, we also had this policy. We also have developed or have had a nursing mother's room at our state capitol since 1996. It's moved locations several different times and got just a new remodeling here now with the new federal breastfeeding legislation. We did some remodeling of it, but that has been available for both staff across all state agencies as well as visitors to our capitol. Another thing that we also do is we've had hospital-grade electric pumps that are available to check out. We have one always located in the nursing mother's room, as well as we have another one up in our offices up here that people can check out. So if they don't have their own pump and just want to bring their kit, then they can utilize that as well. Another part of that is kind of separate outside of what we do directly here at our health department is that back in 2009, when our state passed our right to breastfeed law, as part of that law there was that the health department would develop an infant-friendly worksite designation program. And so we were tasked to develop that program, and so the worksites must have 4 different aspects, and pretty much they all kind of follow suit with what was added to the federal law. But basically they need to be, must have flexible break times so that the mom can express milk. They must have a place that's not a bathroom, that's private for them to do their expression of milk. There must be some storage for them to either the ability to put it in a fridge or have to bring something to their work site to be able to store their breast milk, as well as have a clean water source nearby. So we've been promoting that program now for probably the last 2-3 years, and we have 46 businesses that have been designated. The one that's shown in the picture there is from North Dakota State University, which if some of you follow some of the football, you may have heard about them making their run for their 3rd national title. But anyway, that's one of their nursing mothers rooms that they have on campus, as they're one of our designated businesses. But I wanted to showcase this as well, as that we've kind of broadened, what we've been doing here at the North Dakota Department of Health to actually help our other businesses figure out how they can support our moms and babies across the state. The last slide here just shows our breastfeeding website, and I would encourage you to go out and check that out if you have time. What is on our website, we have our online application for the businesses that would like to become infant-friendly. There's also a list of all of our businesses across the state, as well as some of them have submitted what's called an employer spotlight, where they talk about how this has benefited their work site, how they made the policy work, and those different types of things. So you can read those about some of our businesses. There's also resources for workplace support. Our policy is listed on there. We need to get the updated one. Our previous policy, now we have a little bit more strengthened into to meet the federal requirements. We added a few pieces of language to our policy, and that'll get uploaded here soon. But our current policy is listed on there, as well as breastfeeding data for our state coalition information, and everything else. So I check that out if you have any time or are looking for some of the resources specific to both our department policy as well as our other work outside of the department.
Great. Thank you for sharing the work you're doing in North Dakota. As you can see, we have another polling question up. Does your agency or organization have an infant at work program? Please go ahead and submit your answers now while I introduce our next speaker. Our next speaker is Lindsay Dermott-Gray. Ms. Dermott-Gray is a breastfeeding coordinator for the state of Nevada. In this position, she develops tools, strategies, and policies to increase breastfeeding rates and access to breastfeeding support in her state. She has been instrumental in the promotion of the Bring Your Baby to Work program at her workplace and has aided in the adoption of this policy by other divisions in her agency. Okay, so the poll is now closed, and it looks like about 3/4 of our participants do not have an infant at work program. And with that, I will now turn it over to Lindsay.
Hello everyone, and I'm going to be sharing Nevada's Department of Health experience with our Bring Your Baby to Work policy. So I'm going to start out by just framing the issue. I really want to look at why this policy is such an important consideration. Today, nearly half of the workforce is made up of women who make an invaluable contribution to their workplace. However, A recent U.S. Census found that more than 1/5 of working women quit their job after their first baby is born because the conflicting demands of work and home can often be too much to balance. And of those who do work, twice as many women as men work in part-time jobs, which are often unstable, low-paying, and without benefits. A national conference examining the intersection of family and work concluded that it is evident that a structural workplace-workforce mismatch exists in which the workplace itself no longer fits the needs of an increasing number of workers. So our goal then is to reduce this mismatch through policies and programs that better meet the needs of working women. One of the most progressive policies to address this mismatch is the Bring Your Baby to Work program. So why does this policy work? Babies do exceptionally well in this stimulating social environment. They love the constant physical contact with mom and their coworkers during break time. Most young babies sleep a lot, and when they're not sleeping, much of a person's job duties can be performed with their baby in a sling or a carrier. One of the most important benefits of this program is how it lends itself to breastfeeding success. Breastfeeding is a wonderfully effective way to soothe a crying baby while also aiding to decrease their rates of illness. Kim from North Dakota already did a really great job going through the benefits for businesses, so I won't reiterate what she stated, but I would say that the most tangible benefit is that employers will benefit from a larger and more diverse workforce, that they would lose when they lose the one-fifth of women who are quitting their jobs after their babies are born. Benefits for families. So now we'll look at some of these benefits for our families. The most tangible benefit, of course, for that is that women and their families benefit from their access to income, health insurance, and retirement income. These things are often absent in part-time work and completely absent if they're not working at all. Other benefits that are seen in the literature and also reported by our moms include an easier transition back to work, an easier continuation of breastfeeding, a built-in social network for moms and babies, and enhanced mother-baby bonding. So now I'm going to talk a bit about how our workplace created our Bring Your Baby to Work policy. We actually modeled our policy after an existing health department in Arizona. And like North Dakota, we introduced it as a pilot program in one division rather than an immediate implementation across all 5. So that way we were able to introduce it as something that we were just experimenting with and trying to make sure that it was going to work for mom, baby, and coworkers. Administration and HR worked together to draft the policy. And for anyone who's considering introducing this type of a policy to their workplace, I would really encourage you to contact Carla Moquin, who's the president at Parenting in the Workplace Institute. She was vital in helping us with support and research and data collection for our moms who went through the program. So next I will go over a few policy highlights. Our policy looks very similar to North Dakota's policy, it sounds like. Full-time or part-time legal guardians can participate, so mom, dad, grandma, grandpa able to participate. If there's any direct patient or client contact, mom and baby cannot participate due to HIPAA laws and confidentiality. Our infants can participate until mobile. So in our particular division, mobility means any form of movement. So if you can crawl, scoot, walk, then we'll need to graduate you from the program. But we do have other divisions within our department who do have the 6-month statute, and so that's something that each division can consider what will work best for them. We also encourage and mandate a pre-program meeting for everyone who'd like to participate in the program where they evaluate each mom or dad's, grandma or grandpa. So far we've only had moms' individual work set up to make sure that their environment is going to be conducive to having a baby there. So if there is not already a private cubicle or office available to the mom, is there one that she could move into temporarily to ensure that she has privacy for breastfeeding and nap time, etc. So more policy highlights. Everyone has to obtain written permission to participate. The parents can never leave the premises without the baby, always have to take the baby with them if they leave the work site, but they can, if they go on break and remain on site, they can leave their baby with a friend coworker for up to 15 minutes. Like Kim said, change diapers in a bathroom, on a changing table, and no sick babies are allowed in the workplace. Also, coworkers can request a baby-free zone for the less baby-friendly workers among us, and participation can be terminated at any time by either party. So now we're going to take a look at our policy in action. And so we have had a newer policy. It started in 2009. It started with a pilot program in one division where we had 5 moms pregnant all at one time. So these are our 5 moms and their babies, pictured with our division administrator, Richard Whitley. So this is where we sort of took the policy for a test drive, see if it would be effective. And as it turned out, today in 2013, it was very effective, and so 3 divisions of our 5 have formally adopted this policy in some version, and a 4th is in the policy creation phase. So in total, we've had 25 mom-baby pairs participated. One of those moms is now on her 2nd child. We've had 4 moms. We have 4 moms currently pregnant who plan to participate, and we have 1 mom who was denied participation due to job requirements, which entailed client interaction, which I discussed earlier as to be a HIPAA violation, so they were not able to participate. We surveyed our moms to find out how the program worked for them, and these are the results of our survey. We found that the moms had an average maternity leave of 8 weeks, and the majority of them reported that they felt a lot more comfortable returning to work earlier than they would have otherwise, knowing that they were going to be able to bring their baby with them to work. Breastfeeding rates of at least 3 months, 95%. That is outstanding, and the next slide is going to really break down those breastfeeding rates a little bit further. The average duration of all breastfeeding moms and non-breastfeeding moms, so the average of all the moms who have participated, 12.5 months. And all attribute breastfeeding success, especially that long duration, in large part to the program. Because as Kim said, a lot of times when women return from maternity leave and they have to set up a pumping schedule, it's ineffective and it's hard to maintain, and therefore they have to give up on their breastfeeding goals. The average amount of saved on child care costs, $2,850, which is a very sizable amount. Only 2 days, sick days taken due to infant illness per mom. And all reported that this policy encouraged them to remain working for their division because they really felt valued by their employer. Now this slide is my favorite slide, and this is our breastfeeding rates. And so you can see the blue bar is our baby to work participants, followed by the red bar, which is the Healthy People 2020 goal for breastfeeding. And on the orange bar, that's Nevada residents in total. And you can see that the baby to work participants far exceeded even the Healthy People 2020 goals. So this is a breastfeeding coordinator's dream slide. So from us to you, some implementation tips if you're looking at trying to promote a policy like this in your workplace. And the most important thing to do would be to create a detailed policy to make sure that you address any potential pitfalls before they present themselves. So things like making sure that you offer a baby-free zone, making sure that you reserve the right to terminate individual participation, making sure that you have any fail-safes in place that may be particular to your situation. And then the next step is to be sure that you communicate those policy parameters to employees to make sure that their concerns are alleviated. And then also you just need to really expect that there's going to be a transition period. Like with most preconceived biases, we fear what we don't know. And so that's what we've seen a lot here, is that people who are apprehensive about the policy, once the babies enter the workplace, they have a complete change of heart, and they're referring to themselves as auntie and grandma and grandpa within a month of the baby being here. So just expect that transition period. And I wanted to end with a few testimonials that highlight some of the themes that I think are the biggest benefits, the biggest takeaways from this policy. This first is a mother's testimonial, and this is from Tiffany Lewis and her little baby Avery, and that's her little baby there sleeping on the floor next to her desk. She says, working for a division that promotes breastfeeding and bonding with my infant has absolutely made me a better mother and a more devoted employee. Since having Avery with me at work, I have continued to meet or exceed my work standards. I arranged my schedule in a way that allows me to be most efficient during her naps and downtimes, and then I'm able to attend to her needs and work on lighter projects when she's awake. And then next I'm going to move to coworkers' testimonial. This is when I requested the testimonials, this one just absolutely stopped me in my track, and people were really falling all over themselves to submit these testimonials, and this was my favorite. This is from Elaine, and she says, "There is a daily routine at my home at the end of my workday when I am asked, 'What was the best part of your day?' I cannot count the number of times that my response was simply and sincerely, 'Seeing Sebastian.' I think it would be safe to say that having the opportunity to be blessed by just looking at his sweet face would uplift anyone and turn around a mediocre day." And that's absolutely my experience with the babies that I worked alongside as well. And lastly, a supervisor's testimonial, and this is Marty and baby Lily here. As a supervisor, I believe that my employee took a shorter maternity leave than she would have if she had to place her new baby in daycare. She also mentions that she thinks that the employee was grateful and wanted to show her appreciation, and that her mom and the coworkers were all extremely thrilled with the program. And lastly, we all become so fond of the babies who enter our workplace that we have to have graduation and retirement parties for them. So you'll see on the left we have Braxton's retirement potluck, and everyone's to sign up and bring something. And he just left, you can see, recently on December 6th. Then at the top right we have Lily's graduation party with her little bib that says, "The sugar made me do it." And then at the bottom right we have Adler's graduation party, and she actually slept through her entire party, but the rest of the office really enjoyed it. And so that's all I have today. So thank you, Kristen.
Great, thanks, Lindsay, and thank you for sharing those testimonials. Those are really great examples of the work that you're doing in Nevada. And as you can see on your screen, we have our final polling question up. Does your agency or organization have a supportive breastfeeding policy and appropriate facilities? So you can go ahead and submit your answers now while I introduce our final speaker. Our final speaker is Lisa Akers. Ms. Akers is a Virginia State Breastfeeding Coordinator where she supports and promotes breastfeeding endeavors for the Commonwealth. This role includes the development of public policy and media campaigns, curricula, publications and training, oversight of the Virginia WIC Breastfeeding Peer Counselor Program, and service as the Virginia Department of Health Liaison to the Virginia Breastfeeding Advisory Committee. Okay, and our poll is now closed, and it looks like a majority of people on the webinar today have both a supportive breastfeeding policy and appropriate facilities. And with that, I will now turn it over to Lisa.
Alrighty, thank you, Kristen. What I'm going to talk to you about today is going to be slightly different than what you've heard thus far, and I'm going to talk to you about what the Virginia Department of Health has done with its partners, actually, in reaching out to businesses in the state of Virginia and to help them develop and create comprehensive lactation support programs in their organization. So before I jump into exactly what we've done, I want to lay a little bit of groundwork and sort of let you know where this came from, where our funding came from this, and that sort of thing. So most of you are probably familiar or have at least heard of the federal CPPW grant. CPPW stands for Communities Putting Prevention to Work. It was a grant that came out in conjunction with the Recovery Act of 2009. It was a 2-year grant, and as you can see here, it's pretty multifaceted. And a small portion of this was related to breastfeeding. Now, when we first received this grant, we sort of looked at some objectives, and we looked at the breastfeeding statistics, we looked at the labor statistics, and what we saw was that approximately 60% of mothers with children under the age of 3 are in the workforce today. So that was sort of an eye-opener, because that's more than 50% of the mothers. So that, coupled with the Affordable Care Act, which was just signed into law around that time, and Section 4207 of the Affordable Care Act specifically speaks to break time for nursing moms. And so we felt like this is the perfect opportunity to reach out to businesses. And going hand in hand with that is also working with licensed child day centers. Licensed child day centers are businesses, so they do fall into the business category. However, they are also the front line for the moms that are going back to work and supporting those moms with their breastfeeding needs. So we felt like those two went hand in hand, and so that is how we developed our grant and moved forward with that. The Virginia Department of Health alone probably could have made a substantial impact with our goals. However, part of the CPPW grant is working with partners and collaborations. So we were able to make a substantial impact with that particular grant through our partnerships. And we obviously went far above and beyond what we had initially intended to do, which I'm going to go into. So one of the biggest partners that we had is the Virginia Breastfeeding Advisory Committee. Now, this is not a coalition, a statewide coalition. This is, as it says, an advisory committee. It is an entity of the Virginia Department of Health, and we formed it in 2006 because we saw a need in the community. Some gaps in care existed, gaps in breastfeeding rates existed. So we pulled together a group of high-level stakeholders that represented various organizations. And what they do is help guide and advise the Virginia Department of Health in some of our practices and programs and policies and that sort of thing. So we have been able to do what we've been able to do thus far because of the partnerships that have been formed here. And this advisory committee is actually made up of 21 different organizations, and I'm not going to read them all to you, but I'll give you a few examples. The American Academy of Pediatrics, the Virginia chapter, the American Congress of Obstetrics and Gynecology, the International Lactation Consultant Association, the Virginia Academy of Nutrition and Dietetics, and we have several other universities and colleges. So you can see we have a very multidisciplinary membership, which is great when it comes to helping to guide the Department of Health. So I'm going to talk to you a little bit about the grant, and then I'm going to move into where we are now, because this really helped to lay the pathway for where we are now. So our goal when we were looking at this grant is we decided that we wanted to work with the largest work sites in Virginia, and that is those employing more than 2,500 employees. And before we did that, we realized that we needed to develop some training around the state. I have a very small team, and we have a very large state. So my small team is not going to be able to reach out to businesses all across the state because it would take the better part of a day to even drive out there sometimes. So what we decided to do was conduct 6 regional trainings. We pulled in the developer of the business case for breastfeeding. She traveled all around the state with us, and we did this very strategically because what we did was we invited community members, we invited community businesses, we invited mayor's office, we invited HR managers, because with the goal that we wanted people all around the Commonwealth to be trained in the business case for breastfeeding. So with that goal in mind, we moved forward with selecting 12 of the largest employers in Virginia, and we wanted to be able to provide them with technical assistance and guidance and also actually supplies. This grant gave us some money to work with, so we wanted to be able to provide them with breast pumps and the needed supplies to set up a lactation room if they so chose. So before we started working with the employers and after we did the regional training, we took a really good, hard look in the mirror at our own policies and our own lactation space, or lack thereof at that point in time. What we found is that we were specifically lacking a policy, number one, and that our room at the central office was that of a closet. It could basically accommodate one mom at a time. It had no ventilation. We were happy to have something, but it really wasn't a lot. So our central office is in Richmond, Virginia, and we have 35 health districts all over the state. The Virginia Department of Health employs approximately 3,500 salaried employees. 2,700 of those approximately are women, and of that, about 24% of those women are of childbearing age. So you're looking at a big chunk of women here. And so what we decided to do was, first of all, we started to try to work on the policy, which we are still doing to this day. And the other part is that we found some space within our building. We have 13 stories in our building. We found a space with 2 connected rooms. I'm not going to read to you exactly what the space consists of because it's on the slide, but it is the ideal lactation space. So we set it up so we could accommodate numerous moms in this room, and we had a ribbon cutting ceremony, and what you see there is our former health commissioner cutting the ribbon for us. So with that, we decided to move on to working with employers. And what I have showing here is basically what we accomplished through the first objective of our grant. We had the 6 regional trainings and we had 87 attendees. So through the work of the Breastfeeding Advisory Committee and through a lot of the outreach, we were able to get 87 attendees, aside from people that were part of the Department of Health or part of the advisory committee, to get them trained in the business case for breastfeeding so they could be our best advocate. The next thing is that we were able to provide technical assistance to 20 employers. If you remember a couple of slides ago, our goal was 12. So we more than met our goal. The smallest employer had 100 employees and the largest employer had 4,200 employees. We had 17 policies that were created, and 55 electric breast pumps and supplies were provided. Now, some of you may know this, some of you may not, but it's been our experience when we went into this early on, we thought that the low-hanging fruit would be the policy. We would start working with the business, we would help them create the policy, and then that would flow right into helping them create a lactation space, whether it be permanent or temporary. We found the opposite to be true. Policies require a lot of input from management and leadership and a lot of hoops to jump through. So that ended up being the most difficult piece for a lot of the businesses. And then the actual easiest piece was helping them set up and find a space. In some cases, like I said, it was temporary, which is, in most cases what's required. And in some cases it was permanent. But we were able to give them the supplies that they needed to help set up their room. So the next phase we moved into is working with child care providers. And as I said, this is also a business, but they're doing much more of a service to their patrons and their employees together. In Virginia, we have approximately 2,500 licensed child day centers and approximately 1,600 licensed family day homes. So if you add those together, that is servicing over 250,000 infants. So that is a big chunk of our citizens that we're missing, and that would be a lot to reach out to. So what we decided to do was work on training the child care consultants, training the child care workers. And the best way that we knew how is to develop a web-based training, which we did here, and you see it pictured. It is basically a PowerPoint presentation with a voiceover is what it is. We have it on our state website. Anyone can access it. You go in and you register. We did develop it through the help of the Wisconsin Department of Health and their 10 Steps to Child Care Friendly process. So that is what it is based on. But we realized after we developed that there are a lot of child care providers that don't have Internet access. And so what we did was we also worked with the Wisconsin Department of Health to develop a hard copy of this resource kit. And it's basically a booklet that walks through the 10 steps, and in the back is a little mini DVD. And the mini DVD contains the web-based training. So if they don't have access to Internet, then they can have access to the DVD copy of the training. So those are the things that happened with regard to our grant. So where are we now? So the funding obviously stopped in 2012, but our work towards this endeavor has not stopped, particularly with more and more information coming out about the Affordable Care Act. So we are continuing to provide technical support to businesses and child care providers. Obviously we don't have the funding for supplies, but we are still able to help them locate resources, set up lactation rooms, and develop policies. Now the biggest hurdle here, as I said earlier, was the policies. We had 17 policies that were developed, but not all of the businesses were willing to share those policies. I did see them. I know that they existed, but they were not willing to send a hard copy because they did not want to be used as an example, sad to say. So I do have a few sample policies that I am able to provide businesses, which I am thankful for. And we still continue to promote our web-based learning and distribute our resource kit or our toolkit. And the way that we're doing that these days is we're really working with WIC nutritionists and peer counselors. And we are giving them the resource kit. And that way when they go out and do their outreach with child care providers, they are able to take the resource kit with them. And that is all for me. I've got my contact information. I know we're going to allow time for question and answer, so thank you very much.
Great. Thank you, Lisa, for sharing the work you're doing in Virginia. And as she mentioned, we will now move into our Q&A session. So if you would like to ask a question to any of our presenters, please type it into the chat box located on your screen. And I actually just wanted to follow up quickly with Dr. Dwelly from North Dakota. Here at ASTHO, we know that you are going through the house lead process, and we wanted to know if you could just describe your experience with that so far for our audience.
Yeah, thanks. Yeah, we have had a real good experience so far, I think, in going through health leads. We are in the process just of aligning all of the things we need to have a site visit, and I would strongly suggest that individuals look at the Health Leads website and consider that, moving in that direction. It just actually helps standardize, I think, and helps us, even as we've moved forward in worksite wellness, to help us standardize kind of a more comprehensive approach to worksite wellness. So I would just encourage everybody to look at the Health Leads website.
Great, thank you, Dr. Dwelly. And our next question is for Lisa from Virginia. How did you gain buy-in from the businesses and child care providers to allow the Department of Health to assist them?
Well, I have to be honest. We trained, obviously, people all throughout the state, but the biggest buy-in for the employers is that we had money, that we were able to help them with some of their supplies. And so a lot of them were not aware of the Affordable Care Act, so we were able to talk about that. That sort of got people's attention because it's the law. They didn't really understand it, so we were able to explain that to them, and we were able to say, okay, we'll help you develop a policy. And in turn with developing that policy, we will also help you set up a lactation space, a room for moms to express breast milk until their child's first year. And all they had, honestly, all we really needed to do was sort of dangle the carrot in front of them that we had the ability to provide funds for them to do, to set up their room, and that opened the door for us.
Thanks, Lisa. And this next question is for Lindsay. What have some of the biggest misconceptions been about the Bring Your Baby to Work program?
I think some of the biggest misconceptions are just not being fully informed about the parameters that were written into the policy, such as not allowing a baby and mom pair to participate if they have contact with clients. So when I put out a questionnaire for the employees to see whether or not they viewed this policy in a positive or negative way, a lot of the people who had reservations about the policy did so because they thought the babies were going to be put in unsafe environments with sometimes clients who are unhealthy or unstable given the mom's particular job duties. And that simply isn't the case because we have in our policy parameters to make sure that babies would never be in an environment where they're having interactions with clients, ever be in an environment where they're unsafe. So I would say that that is a large misconception. Another misconception would be that productivity or professionalism would decrease. And what we have seen across the board is that happy employees are productive employees. And endorphins increase when you see a baby. You'll go from being, having just, as the coworker said, just a mediocre day, and you'll just see the baby's face and get a rush of energy, and it'll completely turn your day around. And so I think those are the two biggest misconceptions that we've found here.
Great, and I don't know if Kim from North Dakota, if you had anything to add about misconceptions in your department.
I think the ones that Lindsay mentioned were probably some of the ones that I could think of, because when we had a big group of babies when my second son was born, actually we had quite a bit of media about our program at that time. People magazine came and did an article about our Infant to Work program, as well as then some of our local newspapers picked it up, and it was very interesting to read a lot of the comments that people would make about those about, and some of those are those things, a lot related to productivity. The people thought that no one was going to get any work done, or that it was going to be not very respectful to people that don't like kids or that don't want kids around, and it was kind of sad to see, yet those opinions are out there. But I really feel like, in general, like Lindsay mentioned too, that the babies really, people just have a different, when you have a baby in the room at a meeting and things, it just brings a whole different aspect and different atmosphere. And it was also very interesting when I had my second son here as well. We were having a meeting with some sales representatives, actually from Gerber, because we were doing some changes with our food packages at WIC, and the representative from Gerber said that was the first time he had been to a meeting with a baby. So I thought it was interesting because he works for Gerber, because that's their prime target, our babies. So I thought that was kind of interesting at that point in time, but it just always just brought a very different aspect to all of our meetings and things. But I think it's just, once you can get past those barriers, I think it's just a wonderful thing.
Great, thank you so much. And we've had one question come in, and I think we'll start with Kim, and then Lindsay may have something to add as well. With the Bring Your Baby to Work program promoting breastfeeding, did mothers who offered formula get the same opportunity, or was that only for breastfeeding moms?
Well, here in North Dakota, it is actually for any parent. So actually dads can also bring their baby to work as well. Initially, the policy was, obviously written to promote breastfeeding and to support breastfeeding, but to make it equal and fair for all of the employees, it is so moms that do formula feed can also bring their babies to work, as well as dads can bring their babies to work too. And so, we've had all different types of the parents bring their babies, and so it's just not exclusive to breastfeeding, even though that was the initial goal.
Okay, thank you. Lindsay, did you have anything to add to that?
No, I would just mirror exactly what Kim said, which is that it's open to absolutely any legal guardian, so mother, father, grandma, grandpa. So formula feeding, express breast milk encouraged. We've had all of it. Although we've only had moms, as I said before, but we have had express breast milk being fed and formula feeding.
Great, thank you. And another question for North Dakota, why is the formalized policy and procedure important when allowing infants at work?
Well, just like as with any policy, I feel that it's so important that you have a formalized policy with this, because it can really outline what the mother and the baby pair can and cannot do, especially when you do have issues of, as we talked about, kind of what other staff perceive as issues with having babies to work. It outlines that so that they know what, the mom can know what is expected of her as well as the other staff around them. And it also makes it really clear that it's really not, that our program, it's not a right for the mom, it's really a privilege and a good benefit for them. And so, as I mentioned, one of the things that's written in the policy is that if if there's issues with having the baby there, or there's disruptions and things like that, those weekly meetings with the supervisor are important to make sure that things are going well for both, to protect that mom and baby as well as for the other coworkers in the office. Because I know, for example, at one point in time there was in our section a baby that ended up leaving early for issues with disruption and things like that, and so it was good that was outlined in that policy so that those things can be followed as well. Also, it just shows the Worksite's commitment to breastfeeding and being family friendly because of having that policy. So I think just overall for both the pros and the cons, I think it's just so important to have that formalized policy, as with any time you're trying to implement some type of a worksite wellness issue.
And this is Terry Dwelly. Just to add to that from an administrative point of view, I think we always are concerned about succession as we move from administration to administration. And I think having formalized policy actually helps institutionalize things and protect things from change as administrations change.
Great, thank you very much. And at this time we're going to end the Q&A section. And I just want to thank everyone for joining us today. And as I mentioned earlier, you will be immediately directed to an evaluation at the conclusion of today's webinar. Please fill this out as it provides us with useful information for our future projects. I would like to thank HRSA's Maternal and Child Health Bureau for sponsoring this webinar, and I would also like to thank our wonderful panel of speakers, Tara Johnson, Dr. Terry Dwelly, Kim Hinnenkamp, Lindsay Dermott-Gray, and Lisa Akers. A recording of today's webinar will be available on our website within the next few days on both of the web pages that are listed on your screen now. Please check our newsletters and website for more information regarding future webinars as well as additional maternal and child health and worksite wellness resources. If you would like to subscribe to ASTHO's Primary Care and Prevention Network newsletter, or if you have any follow-up questions, please feel free to contact me at kwan@astho.org. We hope that all of the listeners will use this webinar as a resource and will share the link with others once it is available. Thank you and enjoy the rest of your day.